Good morning, Ma'am Helen. My name is Josephine Dulay, and for today, I will be performing the procedure in assessing the skin. So, the skin is the largest organ in the body. It serves as a physical barrier that protects the underlying tissues and organs against microorganisms, physical trauma, ultraviolet radiation, and dehydration. Also, physical assessment of the skin is very important because it provides data that may reveal local or systemic conditions or alterations in the client's self-care activities. So let's start with the assessment and planning. The first one would be checking for the doctor's order. So it is vital to check for the doctor's order in achieving and maintaining good health. Also, their diagnosis and treatment plan will be useless if we will not follow it. Also, checking for the doctor's order will determine the need for assessing the skin. Next is to gather all the materials needed. So for this procedure, we'll be needing the millimeter ruler, the magnifying glass, and the examination gloves. So having all the materials complete will help save time and will facilitate the accomplishment of tasks. So the next one is for the implementation. So first is to identify the client. So we will introduce ourselves first, and then we will be identifying the client by asking his or her name and birthday. So this is a form of verification that we are in the correct client. So ma'am, good morning. My name is Josephine Dulay and I am your nurse for today. May I know your name, ma'am? Okay, Miss Ella. May I know your birthday? Okay, that's great, ma'am. Next is to explain the procedure to the client, why is it necessary, and how he or she can cooperate with the procedure. An explanation will provide the client or will reduce the client's apprehension and will promote cooperation. So ma'am, for today, I will be assessing your skin. So is that okay with you, ma'am? That's great, ma'am. Are you comfortable with your current position? That's good to hear, ma'am. Next is to wash our hands and observe for the appropriate infection control procedures. It is very important to always wash our hands because this will prevent the spread of microorganisms. So as of this moment, I've already washed my hands, so let's assume that we are performing the procedure right now. But in the real setting, we should always wash our hands because it is very necessary in infection control. So, as of now, I am sanitizing my hand to get rid of the microorganisms. Next is to provide for client privacy. So, consideration for the comfort of the client is very important. So, we will provide privacy for our client by closing our curtains or doors in order to give privacy and warmth to them. And now, we will be interviewing the client's history of the following. So, ma'am, are you having any pain or itching in your skin before? Okay, ma'am. So, do you have any lesions, abrasions, pigmented spots, or bruises in your skin, ma'am? Okay. So, do you have any history or your family has a history of skin problem, ma'am? Okay. So, do you have any signs of skin problems, ma'am? Okay. So, ma'am, are you using any lotion or home remedies? Okay. So, are you using medications, ma'am? Okay. So, does your skin easily get bruised? Okay, ma'am. So, is your skin excessively dry or moist, ma'am? Okay. So do you have any condition that may be associated with your skin problem, ma'am? Okay. So do you have any problem with the seasons of the year, ma'am? As with regards with your skin? Okay, ma'am. So asking these questions is very important because this can provide data for us to reveal any local or systemic conditions. So pain or itching, the presence of lesions, abrasions, bruises or pigmented spots, the tendency of the skin to get easily bruised, excessively dry or moist skin may indicate or may reveal systemic conditions or local conditions or underlying skin problems. Also, the use of lotions, home remedies, or any medications can give allergic reactions to the client. Also, asking for the history of skin problems in the family members of our client is very important because skin problems can also be associated with genetics. And also, the seasons of the year can also give a big impact in the condition of the skin of the client. So now, let's proceed with the assessment. First is to inspect for the client's skin color. So we should take note that the amount of pigment in the skin accounts for the intensity of color and hue. For the normal findings, the skin is usually even and does not have any prominent discolorations. For the abnormal findings, we should also take note of pallor, which is the loss of color of the skin, the cyanosis, for the blue-tinted skin, for the jaundice, which is the yellow-toned skin, and for the acanthosis nigricans, for the darkening of skin in the body folds. So now, we will inspect for the client's skin color. Okay. So, I will be asking the client to stand so that I can inspect the back of the client for any discoloration or any abnormalities. So, ma'am, can you stand, please? So, assuming that our client is standing, so we will check the back of our client. Okay, so now we will be inspecting the uniformity of the skin color of the client. So it is important for us to know if the color of the skin of our client is uniform. Also, we should take note for the variations in the skin color because melanin can be or may vary in certain areas of the skin. So we will inspect for the uniformity. Okay. Next, we will assess if edema is present. So we will be using our two thumbs to palpate the feet. So for normal findings, the skin rebounds and does not remain indented. For abnormal findings, the skin has indentations and this will indicate an edema. Next is we will inspect, palpate, and describe lesions, and we will be applying gloves if the lesions are open or draining. So now let's check or inspect for our client's skin to see if there is any lesion. Okay, so I have found a small lesion in here, and then it is open. So we should take note that if the lesion is draining or open, we should use gloves. Now, I will be applying my gloves for this method. So let's just fit in our gloves. We'll be using a magnifying glass to note the characteristics of a small lesion that we have found in our client's hand. Okay, so we've already seen the small lesion. Now, we will measure the lesion with a ruler. So we should make sure to not touch the lesion. We should measure it carefully. Okay, so we should take note of that for our documentation later on. Okay, so for the rationale, so for the normal findings, the skin should be free from any lesions. For the abnormal findings, of course, the skin has lesions. So this may indicate any local or systemic conditions. So we should always take note of that if we have found any lesions in the skin of our client. So now, we will observe and palpate for the moisture of the skin, as well as we will palpate for the skin temperature. So we will be using our dorsal surfaces or the back of our hand in palpating for skin moisture and skin temperature. Okay, so for the moisture of the skin, the normal findings, skin moisture may vary from moist to dry depending on the area to be assessed. So warm environment may cause increased moisture. So for the abnormal findings, increased moisture or diaphoresis may occur in conditions such as fever or hyperthyroidism. On the other hand, decreased moisture may indicate dehydration or hypothyroidism. For the skin temperature, the normal findings is the skin should be a warm temperature. For the abnormal findings, cold skin may accompany with hypotension and also with arterial diseases. On the other hand, a very warm skin may indicate a febrile state or hyperthyroidism. Next is, we will be noting the turgor and mobility of the skin. So first, we will be asking our client to lie down. So ma'am, can you please lie down? Okay. So, we will let our client lie down, and then using our two fingers, we will pinch the clavicle of our client. So since our teddy bear doesn't have any clavicle in here, so we will assume that this is the clavicle. So we will pinch the clavicle and we will take note for mobility and turgor. So by the way, mobility refers to how easily the skin can be pinched, and turgor refers to the skin's elasticity and how quickly the skin returns to its original shape after being pinched. So let's take note for that. Again. Okay, so for the rationale for this, so decreased mobility may be seen with edema. Also, decreased turgor may indicate dehydration. So for the evaluation and documentation, document the findings in the client's record and draw the location of the skin lesion on the body surface diagram. So for this reason, documenting the data will help in making the plan of care for the client. So that is all for assessing the skin. Thank you.